Okay, so this meeting will be recorded. If you are not comfortable with that and do not like to be recorded, please do leave the meeting, but keep in mind that today's presentation will be recorded. Oh my goodness. Okay, one moment, having a little bit of technical difficulties here. There we go. Okay, so presentation will be recorded as noted before and posted on our Aging and Long-Term Services Department website. Please keep your camera off and your microphone muted. Questions will be taken at the end of the presentation. You may type your questions into the chat so that you don't forget them and we can go back and review them, or go ahead and write and note that down on a piece of paper and you can ask at the end of the presentation. And as I said, they will be answered at the end of the presentation. Okay, so this is the presentation regarding Medicare. This is Medicare 101. This is an example of what a Medicare card would look like. Here are workshop objectives. Today, I'm going to introduce important consumer assistance programs such as SHIP and SMP, give the Medicare updates for 2023, talk about Medicare Parts A, B, C, and D, Medicare enrollment, Medicare options, COVID updates, and resources. So your New Mexico SHIP stands for the State Health Insurance Assistance Program. What we have in our program is federal partnership, counseling, education, outreach.
Hi, Carl.
Free and unbiased by your SHIP counselors, people on Medicare, that's who we help, family members as well, and caregivers. So what is New Mexico SMP? SMP stands for Senior Medical Patrol. Under that program, what that does is we have the healthcare fraud prevention. We help Medicare and Medicaid beneficiaries avoid, detect, and prevent healthcare fraud. We help preserve the integrity of the Medicare and Medicaid programs, and we educate and inform Medicare beneficiaries how to protect their personal identity, identify and report errors on their healthcare bills, and identify deceptive healthcare practices, such as illegal marketing, providing unnecessary or inappropriate services, and charging for services that were never provided. Medicare 101. Medicare is health insurance for who? Adults 65 years of age or older, younger adults with certain disabilities, and anyone with end-stage renal disease. To be Medicare eligible, you have to be 65 years of age or older. Upon turning 65, a person qualifies for Medicare if they collect or qualify to collect Social Security or railroad retirement benefits, or the person is a current U.S. citizen and either a U.S. citizen or a permanent resident having lived in the U.S. for 5 years in a row before applying for Medicare. Medicare eligibility for people who are under 65 is a person not yet 65 who qualifies for Medicare if they land under these qualifications. They have received Social Security Disability Insurance, also known as SSDI, or Railroad Disability Annuity checks for total disability for at least 24 months. Please note that if they have amyotrophic lateral sclerosis, also known as ALS, there is no waiting period and they are eligible for Medicare when they start receiving SSDI, or they have end-stage renal disease, also known as ESRD, or kidney failure, and they or a family member have enough Medicare work history. Enrollment. It is automatic if you already receive a Social Security check. You enroll online at the website www.ssa.gov or visit your local Social Security Administration office. You can enroll during this time period, 3 months before you turn 65, the month you turn 65, or 3 months after you turn 65. During this enrollment period, it's a total of 7 months. That is called your initial enrollment period. Another enrollment period is also known as the general enrollment period, which occurs January the 1st through March 31st. During that time, coverage begins the month after the month of enrollment. So the special enrollment period is another enrollment period, which indicates that you potentially you're moving, your employer coverage ends, or you're entering or leaving a long-term care facility. Here's some more information regarding the beneficiary enrollment simplification. Beginning January 1st of 2023, Medicare coverage will become effective sooner for individuals enrolling in the last 3 months of their initial enrollment period, or in the general enrollment period. Coverage for these individuals will be effective the month after their month of enrollment. There are also technical changes to the calculation for Medicare late enrollment penalties. Special enrollment periods with no late enrollment penalties may be established for individuals who meet exceptional conditions specified by the U.S. Department of Health and Human Services, also known as HHS. Okay, so the beneficiary enrollment simplification, new special enrollment periods, also known as SEP. So during the special enrollment period, it's an individual or an individual authorized representative, their legal guardian, caregiver was impacted by a disaster or emergency. Recently on the news, our governor has established a declaration of emergency due to some floods that are occurring up in the northern part of our state. So since it's declared a disaster, that would be a situation where this would fall under that category. So this occurs the day the federal, state, or local government declares the emergency or disaster, or the date in which the declaration, whichever is earlier. When does it end? It ends 6 months after whichever of these happens later. The end date in the original declaration, the last day of any extensions to the declaration, the date the government revokes or announces the end of the declaration. And when does coverage start? The month after enrollment is submitted. Beneficiary enrollment simplification, new special enrollment periods. Continued information from previous. When is a special enrollment period? Here's an example: health plan or employer error. When does this occur? The day the individual notifies Social Security that the health plan or employer misrepresented or provided incorrect information. When does the special enrollment period end? 6 months after individual notifies Social Security. And the coverage begins the month after enrollment. Formerly incarcerated individuals is another special enrollment period that occurs from when the day the individual is released from incarceration. It ends the last day of the 12th month after the month the individual is released. Coverage begins the month after enrollment, or the individual can choose retroactive back to their release date, not to exceed 6 months. One common one is termination of Medicaid coverage, which I say common because of what's happening now in the country due to COVID and Medicare ending for many people. What happens during this time? This is a special enrollment period. When does this occur? It occurs the day the individual is notified that Medicaid coverage is ending. It ends 6 months after Medicaid coverage ends. The coverage would begin, once enrolled, would be the month after, unless the individual elects a start date of the first day of the month they lost Medicaid and agrees to pay all prior premiums. There is also other exceptional conditions for a special enrollment period. Once Social Security decides whether the individual qualifies for a special enrollment period, that's when the special enrollment period occurs. It ends 6 months after that. Coverage begins the month after enrollment. Here's what your Medicaid card would look like. Please keep it and accept Medicare Part A and Part B. If you decide not to receive Part B and refuse it, please follow the instructions on the back of the card. If you also can note here, the back of the card does have the phone numbers and the website where you can obtain more information regarding this. Okay, so let's decide how you would want coverage. So this is a pretty important decision to make for initially starting your Medicare. You need to decide whether you want original Medicare or a Medicare Advantage plan. If you can see on the flow chart here, original Medicare would be your Part A and your Part D and your Part D, or a Medigap if you choose to purchase one. The Medicare Advantage plan typically bundles the parts A, Part B, and Part D, which would be known as Part C. And that's if you join the plan. You do not need and cannot be sold a Medigap policy. Keep that in mind if you decide to enroll in a Medicare Advantage plan. What is Part A? Part A is hospital insurance. And what does it cover? It covers inpatient care in a hospital, skilled nursing facility care, nursing home care, such as inpatient care in a skilled nursing facility that's not custodial or long-term care. Part A also covers hospice care. And lastly, Part A covers home health care. For Part A, most people don't pay a premium for Part A. If you paid Federal Insurance Contributions Act, which is your FICA, your taxes, for at least 10 years, your deductible is $1,556 per benefit, period. If you paid FICA less than 10 years, you may have to pay a premium to get Part A. You may have a penalty if you don't enroll when you're first eligible, or you may be able to get a free Part A if you qualify for Medicaid. Part B, which is called your medical insurance. What does that cover? It covers clinical research, ambulance services, durable medical equipment, mental health, such as inpatient, outpatient, and partial hospitalization, as well as some limited outpatient prescription drugs. The cost for Part B in 2023. The standard Part B premium is $164.90. Most deductibles are $226. Coinsurance for Part B services are 20% coinsurance for most covered services like doctor services and some preventative services, if provider accepts assignment. $0 for some preventative services. Under Part B, there's a 20% coinsurance for outpatient mental health services and copayments for hospital outpatient services. Under Part B, durable medical equipment has a 20% coinsurance. Considerations for Part B enrollments. You can opt out or delay enrollment only if you are covered by your own or your spouse's active employer you are covered by your own or your spouse's active employer group health plan, and the employer group health plan covers you as a primary health insurance. Part B considerations also include COBRA, but in this case, COBRA is not considered active employer group health benefits. Retiree coverage is not considered active employer group health benefits. Many retiree plans, including TRICARE for Life, require Part D enrollment. Part B late enrollment penalty. That applies for people who waited too long or delayed their enrollment in Part B. Their premium goes up 10% for each 12-month period for the life of the coverage. For Part B special enrollment periods, those are available for those who have had employer group health benefits and enrolled in Part B within 8 months of losing employer coverage. Part B, when not to opt out of Part B. If you want to buy a Medigap policy, if you want to enroll in a Medicare Advantage plan, if you have or will have TRICARE for life. Lastly, if your employer or retiree plan requires it. Part D, also known as your prescription drug coverage. Well, Part D is outpatient prescription drug coverage. It's accessible through private companies that sell Medicare drug coverage. List of covered drugs or formularies vary per plan. The costs vary per plan, and coverage includes generic and brand name drugs. Eligibility for Part D would be that you must have Medicare Part A and or B. You must live in the plan service area. And to avoid penalties, beneficiaries without credible drug coverage should join with when first eligible. The cost for Part D. Your deductible is up to $505 in the year 2023, which varies also by plan. Your monthly premiums varies by the plan that you enroll in, and your co-payments and co-insurance depend on your prescriptions and drug plan. Part D, your penalty for late enrollments. If this is a category you fall under, it's 1% of the national base premium multiplied by each month you're not enrolled for the life of the coverage. The example below lists here that if you had a $33.06 premium, you multiply that by 1%, which is 33 cents. For the 24 months that you didn't have it, that would be $7.92. So to avoid penalty, please make sure you provide documentation of credible coverage to the Social Security Administration if you didn't take it when initially needed to do so. Medigap policies, also known as supplemental insurance. What is a Medigap policy? It is a policy that can be purchased to cover your out-of-pocket expenses for covered benefits with original Medicare. Some policies will pay for your co-payments or co-insurance. Plans are identified by letters, and they are sold by private insurance companies. To look for those plans, this is the Medicare.gov website. This is what it looks like currently. It does change the picture from time to time, but not often. But this is what it is as of today. If you look up here where I am scrolling my arrow, you would see health and drug plans. Once on the website at Medicare.gov, you could click there and go through a couple of windows, and you will find the Medigap policy plans. Part C, also known as the Medicare Advantage plans. Those are not a separate Medicare benefit, but the alternative way to receive Medicare benefits. They're run by private insurance companies that contract with Medicare. Most Medicare Advantage plans include Medicare Parts A, B, and D. To be eligible, you must have Medicare Part A and B to join a Medicare Advantage plan. You must live in the plan service area, and you cannot have ESRD. Part C, what is the cost for that? There is an annual deductible, but each plan is different. There's a monthly premium, which is your Part B premium, plus the Medicare Advantage plan's monthly premium. Premiums charged by the Medicare Advantage plan vary. Co-pays and co-insurance, which depends on the plan that you choose. During fall open enrollment, that is the opportunity to shop around for Medicare Advantage plans. Call your plan for details about changes to costs for services and medications, which you could find behind your current Medicare Advantage plan card if you have one. If you're interested in a private insurance company, you can call that insurance company directly and get more information on the Medicare Advantage plans that they offer. Well, what does Part C cover? Options for medical advantage plans are as follows. There are HMOs, which is the health maintenance organizations, the PPOs, preferred provider organizations, or the PFFS, which is the private fee for service, SMP, a special needs plan, and MSA, a medical savings account. Some services are covered under the Medicare A and B, and also under Part C. Plans may include added benefits such as prescription drug coverage, vision, hearing, or dental. Here we see how to get started, and here's the website for Medicare. Once you have Medicare, the information can be found online on the website you see on the screen, www.medicare.gov. Here, the Medicare has the basic steps to go ahead and sign up. If you do sign up, you will be instructed to go to Social Security Administration. So please don't get confused if you do go to the Medicare.gov website to sign up for Medicare, and you are redirected to the Social Security Administration website. What you can also find on this screen is the basic information regarding Medicare, as you see here for step 1. You can click on any of these items here to get more detailed information. Here in step 2 is where you would sign up. You would simply click on these links and indicate what you would like to do. If you'd like to get more coverage, you would click in this section. And there's information here on using your Medicare. Please do refer to this website often as yearly Medicare policies change. How does Medicare work with Medicaid? So there is a program with New Mexico called the Medicare Savings Program. And what that does is it covers Medicare premium costs for limited income beneficiaries who qualify. There are 3 different categories depending on your income. You can apply online at this website, which is www.yes.state.nm.us, or you can call the Aging and Disability Resource Center at 1-800-432-2080 to get assistance in applying for this program. How does Medicare work with Medicaid? So there is a home and community-based waiver, also known as the HCBW, and Centennial Care. This program here provides full Medicaid for limited income people who meet nursing facility level of care. But with in-home caregiving services, they can remain in a community setting rather than a nursing facility placement. You would apply for this program through the ADRC. The contact information for ADRC will also be provided at the end of this presentation. So if you didn't get it on the slide before, I will have it for you at the end. Institutional care waiver. What this is full Medicaid program for limited income people who must reside in a skilled nursing facility or rehab. You apply to the Income Support Division. That information would also be provided at the end of this presentation. Here it is once more. The 2 programs that we just spoke about, the home community-based waiver. There is the website, www.yes.state.nm.us. And if you can see the picture here, this is currently what you would be seeing if you did log in today. There is another program called the Affordable Connectivity Program. It is a federally run program for low-income households who need assistance to pay for their internet services for devices such as a laptop or a tablet. The website for this, I'm indicating here with the arrow, it is www.affordableconnectivity.gov. Once on that website, this is where you could apply for internet service for your household if this is something that you would need. Here are the qualifications to be eligible. You will have an up to a $30 a month discount on your internet service, up to a $75 a month discount if your household is on a qualifying tribal land. You would receive a one-time discount of up to $100 for a laptop, tablet, or desktop computer with a co-payment of more than $10, but not less than 50. But less than 50, sorry. And it is also a low-cost service plan that may be fully covered through ACP. This is the Aging and Long-Term Services Department website. So if you log into our services to get assistance or see the services we have to offer, this is what you would be looking at. You see below on the bottom of the screen, the website is stated here. It's www.newmexicoaging.state.nm.us, and our phone number, which is 1-800-432-2080. The Aging and Disability Resource Center. What services do we offer? We offer options counseling, home and community-based waiver registration and assistance, network of care resources, short-term assistance, SHIP counseling, senior medical patrol assistance, prescription drug assistance program, and below is our phone number and our website. Once again, that is 1-800-432-2080, or visiting our website, that would be www.nmaging.state.nm.us. If you have any questions, we do also have a web chat option available, which is very convenient and would get the counseling that you need or any questions answered as well. To be able to access that, you would go to our website, www.newmexicoaging.state.nm.us, or you could call our office. You would get the one-to-one counseling and the assistance that you're requesting as quickly and as best as possible. Our phone number is 1-800-432-2080. And here is my contact information. My name again is Melissa Luna. My email address is listed on the screen. It is melissa.luna@altsd.nm.gov. I am a SHIP counselor. If you would like to reach our Santa Fe office, our phone number is 1-800-432-2080. We would be more than happy to assist you. If we don't have enough time during this presentation to be able to do that, please do email me or call our 1-800 number so we can help you further. We also have a YouTube channel. If you would see there in the center of the screen, I will point that out. It is titled ALTSD New Mexico State-YouTube. There are several videos there that you can stop and pause and take notes if you'd like, so that you can get the information at your convenience and at the rate that you would like. Here at the bottom, once again, is our website. It is www.nmaging.state.nm.us. Our phone number, 1-800-432-2080. We also have a Facebook address, so you can follow us on Facebook for the most recent news. That is New Mexico Aging and Long-Term Services Department. And here is the last information for this presentation. If you have the time, I would appreciate a customer satisfaction survey. Feedback is important. You can complete it here at the website below. And I'm pointing this out here with the arrow. I will leave that there so you can note that down. And I will also read it for you. It's https://www.surveymonkey.com/r/ACLED. I will go ahead and take questions now if there are any.
Hi, Melissa.
Hi.
Thanks for sharing this. Can you put the SurveyMonkey picture back up?
Yes,
I'll make it easy for me to type it in because I couldn't swipe it. How do we, I guess, and then this, I'm about a year away from actually having to do this stuff. How do we evaluate, which of these Medigap or Medicare Advantage programs is the best, and how do we make sure we don't get hooked into a fraudulent or one that promises more than they actually deliver?
So first of all, with the Medigap, what you should do is, first of all, is take consideration your health, your medical situation, your health situation. And I would also consider your family medical history. Several people have mothers, fathers, grandmothers, grandfathers, and see what type of illnesses that they have. And they say, well, I might have this in the future. So if you look in the through the Medigap policies, you can see what they would cover. On we're going to go to Did you get the information for the Survey Monkey?
Yeah, I did. I got it
Okay.
all set.
Okay. So I am going to see if I can get you one moment, okay?
Sure.
If I can get
I just,
let me go back to,
yeah, I mean, what I always hear all the bad stories on the news.
yes, well, fraud, I understand where that's coming from, and you're going to hear that often. People want to make a dollar, so, you know, they're going to try to lure people in. You're going to hear a lot of, you're going to receive a lot of phone calls, probably. You're going to definitely receive a lot of mail because of your age, and it's going to be solicitations, advertising to see if, you know, if you want to purchase a program with them. But the Medigap policy for you, they cover different, there's a variety of coverage. So the Medicare.gov website that we talked about earlier, I'm going to go ahead and go way back to the beginning of that so
Okay.
that you can see. Okay, so this screen right here, this is the screen that you're going to log into for the www.medicare.gov, and you're going to see this gentleman there. When you get there, if you can see my arrow, can you still see my screen?
I do.
Okay, so when you click here on the health and drug plans, there is an opportunity to open up the Medigap chart, and you will see all of the letters, the plans that are available. And when you see that they're there, you can evaluate how much coverage you're going to need. First, I would advise for you to look at that before you even reach out to an insurance company and see which part you would be you think would benefit you the most before you start calling people out. Did you note down our phone number?
No, but like I said, I'm a year away. I'll be talking to you guys more once I get closer. Do
Okay.
all the healthcare plans then answer a similar template so you can compare apples to apples, or do they cloud it up with jargon and hide the details?
Each plan is different, and by law, they are all required to provide the same coverage. The only difference you're going to find is price. Let me give you our phone number. I know you said you're a year away, but it is best to maybe kind of do a check-in every few months, because the Medicare does change. When I say it does change, sometimes it's the premium. We don't really know until the changes come up. Are you ready for that phone number?
I am.
Okay, it's 1-800-432-2080.
2080. That's
Yes,
great.
sir. And
Yeah,
I would advise you to call us, because we don't endorse or favor any insurance companies. So if you call us, it'll be non-biased. We can tell you exactly what Medigaps are out there, and then you can go ahead and make your decision from there.
Yeah, my wife's got a number of health issues and probably has some knee replacements coming, and I want to make sure we, get somebody else to pay as much of that cost as we can.
Okay. Yes. So give us a call, and you can schedule an appointment, and you can definitely get that one-to-one counseling way before you have to sign up. But it'll be good to have it all nice and neatly ready to go when it's time to sign up.
Okay.
Any other
right.
questions?
I think this is a great program, and I'm glad you presented it to us.
Great. And please do keep in mind that we do this monthly. So please feel free to get on our website and log in. Every month it's a different topic. And since you do have a year before making that decision, if you visit us, you don't have to stay for the whole presentation, but you can see what the objective is and see if it's something that you would need at that time.
Okay, thank you.
Okay. All right. And I'm going to check the chat quickly to see if there's any questions there, just to make sure. I don't see any there, so there's none that I need to answer. Okay. That is the presentation for today. Please do contact our office if you do have additional questions or would like to schedule an appointment. We'd be more than happy to help. Thank you very much, everybody, for attending, and have a wonderful day.